Hi, school people! Welcome to Share Your Story!
Yay!
Okay, so as you can see that we have two special guests with us here today. But before I introduce you to our special guest here, I want to explain what are we going to talk here and what are we going to discuss. So here we are going to talk about very interesting topics. So it's a hot topic that everyone's been talking about lately, and yes, you're right. It's about healthcare system. Yes, so we are going to share their experience regarding their exchange journey here in Indonesia, and they're going to share their thoughts about Indonesian healthcare systems and also compare to their own country. Okay, so without further ado, let's introduce our special guests, Flora and Ella. Woo! Okay, so Flora, introduce yourself to our audience and also your country, and Ella, you can do the same.
Okay. Hello, I'm Flora. I'm from Germany, and I'm 21 years old, and I'm a medical student in my third year currently.
Hello, I'm Ella. I'm a medical student from Germany as well. I'm in my last year of medical studies, and it's my first step here in Indonesia. And, I really like it.
What do you like the most about Indonesia? The food, the people.
The food is spicy.
It's so spicy.
Yeah.
It's different.
But
It's different.
Yeah, but the people are very loving and very
Yes.
welcoming. So that's
Yes, for me, the kind of people as well.
They're being too nice. Or okay, so because you've been here for 3 weeks, I think you have met the people, and then you have tasted the foods, and you have also visited the hospital and the university, and also the primary healthcare. That's what I'm really curious about. So, what was your first impression when you first came to the primary healthcare or the hospital? Maybe to the doctors, the patients. Please tell us your experience. Maybe who wants to start first?
I can talk first.
Okay.
So yesterday we visited the primary healthcare. It was our first time there. We had a lecture there, a presentation from the doctor there. She told us in Indonesian, but we got an explanation about their diseases, how many people there come with which diseases, what are the good things, what are the bad things. And it was a nice discussion. There was a doctor from mental health too. He told us really precisely and detailed about his growth and people with mental health problems. It was a good insight. It was really nice.
I'm so glad. Like I've heard that you also focus on the mental health problem here in public health exchange. So I want to know like your opinion too regarding our mental health disease here and also like how we treated the patients. That would be interesting. Great. Yeah, maybe I want to.
yes. So I think you have to deal with a lot of mental health problems here as well as they are in Germany, and I think it's not a topic that is talked much about. First we heard about preventive programs for teenagers, for elderly people. So there is a lot of change, but there's still some points that needs more be promoted.
Yeah. You need more attention.
Yeah.
Like that's a very nice impression of Indonesia. I'm glad that you feel that kind of way. And so because you have observed like the university and also the hospital, from your perspective as a medical student, like what are some strengths that you've observed in Indonesia's healthcare system? Maybe you want to start first?
So I think it's very easy to access. Yeah. For many people, when they have any healthcare problem, they just can go to the GP, to the Puskesmas, to the primary healthcare, and they have an appointment. They see the doctor. They get medication. So it's easy access. It's an easy access for everybody if they want to. So I think this is one of the main things in the system we notice.
Like how's the primary healthcare in Germany? Do you also have the same Puskesmas or do you have another?
We also have good customers. No, it's not. So it was really nice to see it. And then we went to a mosque, turned to a Muslim mosque in this area. So women or mothers with their little children from newborn to 5 years old came. They could discuss together. The babies and the children got weighted, and the height was measured. They got vitamin A vaccination or treatment, supplement. So this was really nice to see this. In Germany, we don't have it. We have a very strict plan for the newborns and for the children that have to visit their pediatric GP. Actually, quite a every month in the first half of the year, and then every year, quite often. And it was so the exchange of the mothers, the talking, the community part, we don't have it in Germany, but we have a good system of GPs. So we can go there to the GPs. We get everything there. We can go there with the first symptom. Um, so yes, no primary healthcare, but a good GP.
So like when they want to go check their kids' health, they go to the hospital directly.
In Germany or Indonesia?
In Germany.
In Germany. No, they go to the GP.
Go to the GP
Specialized
first.
So the pediatrician, yeah.
Yes, okay, that was great. Okay, but I'm so sorry, but I forgot to tell the audience that they are an exchange student from Germany here with the public health exchange program. So they here observing the primary healthcare and also the university, the hospital to see the Indonesian healthcare system like in the more depth and personal way. Like if you just go to the hospital, I think you won't see the how the puskesmas work because the primary healthcare and university and the hospital they're totally different. So I think that was like, really great. Okay, so you have said the good things about Indonesian healthcare system. So I want to know maybe the challenges. You know, what is the challenges that you think Indonesia still faces in achieving universal health coverage?
I think one of the challenges is that the people need to pay the money for the health insurance on a regular basis because we learned today that it's quite often that the people only pay when they get sick. So I think it's really important to support the conventional medicine and also have the alternative medicine that could support and have a more of focus on the conventional medicine, maybe.
We need to pay. That's like the
Yeah.
challenges. Okay, so great. Like that's a great insight. So next, Germany. We know that it's a developed country. It's a has a long established universal health coverage system. So how does the system in Germany work for its citizens?
We can choose between the agencies. This is good point. They have some options who are slightly different. Everyone has to have a health insurance, and for members of the government or for teachers, there is the possibility to go to have a private health insurance. There are some more benefits and easier extra appointments. Yes, and if you want to go or have the private health insurance, this is only for people with high salary, but it is possible to have a private health insurance as well.
That's also similar in Indonesia. We also have our national health insurance from the government. We call it BPJS. So it's basically like for all the citizens here. But the problem is that it doesn't cover everything. So if you want like a better room in the hospital, you want better medicine, you need to pay more. And that's the private insurance. It also works for the rich people. Okay, so I want to know what are some of the biggest differences that you notice between Germany's and Indonesia's healthcare system?
I think one of the main differences that in Indonesia it's more divided. Like you have A level, B level, C level, and D level type of hospitals. And also, we talked to a GP today, a general practitioner, and she told us that it's much more complicated to get money back from the insurance when you treat patients. and we also talked to residents, member of the neonatology, and we thought that the residency is much more underpaid than Germany and also underappreciated.
I think that's a global problem. Underpaid. Okay, so what? How about the affordability? I mean, how does health insurance coverage in Germany compare to Indonesia? BPJS system. So BPJS is the national health insurance.
So in Germany, all these are covered by the health insurance. I think this is the main difference to Indonesia, where only 150 diseases are covered. So in Germany, you don't have to matter or to think about which symptom I can go to the doctor or not.
Okay, so in your opinion, what lessons can Indonesia learn from Germany's experience in implementing universal health coverage? And what can Germany learn from Indonesia? So you want mutual things. You want to your opinion?
I think we can learn that we can get a more easy access to general practitioners and also the digitalization at the GP and in the ER. We went to the ER today and they had all the X-rays and laboratory numbers on the phone. It was so good. It was so digital.
We have to focus on mental health problems, and we have to include patients with disabilities, physical and mental. We have to think and discuss subcultures and minorities such as LGBTQI plus, or persons with STDIs, or patients with HIV. I think these minorities are rarely referred to and rarely discussed, and we have to focus on them more.
I think that's a great advice on Asia because we're still like struggling. We're trying to improve and make the inclusivity and the diversity, but I hope that we can be better, next year maybe with the new regulations. Okay, so finally, it's the last question. So, tell us your wish for universal health coverage day globally. So, what do you want? Maybe more accessible to the healthcare or anything?
I think our wish is that more people have a general access to healthcare, that there's no stigmatization of minorities, no need to cut off costs because of the governmental financial status, more tolerance of subcultures, religious groups, and people with rare or chronic diseases.
Totally agree. My wish is that we get in touch with other countries. We have an exchange with other countries and in different healthcare systems. It's really great when we exchange our view of diseases and how to treat patients. It would be great if we see the patient as a whole, so as a systematic individual, as a person, and if we focus on our personal resources, because everyone can be a healthy human. Yeah.
Yeah, I think that's what Indonesia is trying to achieve, the patient-centered care. So we're trying to make the patient as the whole person that we see from each aspect. Okay, so that's a really nice sharing session, like the experience and then your thoughts regarding Indonesian healthcare system. I'm so happy that you guys are, feel welcomed and you have a great experience here while you do your journey.
Thank you.
Yes,
We are
thank
very
you.
happy and very grateful for this experience and for the opportunity. Thank you.
No, okay, so maybe you can say goodbye to our audience. So, this is the end of our sharing session for the Share Your Story. So, I hope that you guys can get new insights regarding the Indonesian healthcare system and also the Germany's healthcare system. And you can get, what is the Germany's healthcare system, like how they treat their patients there, and also how's the foreigners really think about Indonesian healthcare system. So, it's done. It's all done.
Thank you for listening.
Thank you for listening.
Thank you.
Bye bye.